It's another episode of the Charity Lounge, and today I'm actually in Nigeria. You know, I always say that wherever I go to, I'll make sure I get someone who is doing great, amazing work in that country. So I'm in Nigeria today, and I have an amazing woman with me. Now, she's a doctor. In the last few weeks, I've had to interview doctors for some weird reasons, not planned, but today I have an amazing doctor here. Dr. Omolola Salako.
Hi. Hello, everyone.
Thank you for gracing this stage, which really is yours. So, Dr. Omolola, can we meet you?
So my name is Dr. Omolola Salako. I'm a consultant clinical oncologist and CEO at Pearl Oncology Specialist Hospital.
Thank you. So, I know you asked me a question that why am I interested in, the medical space? It's really not intentional. Like, I don't think I set out to say, I want to be talking to doctors. I just find that I'm attracting a lot of doctors. I don't know if I should put it that way. And yeah, I found you again, and you're doing very amazing work out there. And we're talking earlier, and you were telling me how you've screened over 30,000 women.
Yeah, for breast and cervical cancer.
Please, can you tell us about that?
Okay. So I founded Sebeccly Cancer Care, an NGO, about 19 years ago. I was just fresh out of school. And it was founded in memory of my late sister. So as I went through medical school and shortly after I graduated, I realized that many women were affected with cancers. So if you walk into any cancer clinic, most patients will be women. And it was just, at the back of my mind. Initially, the NGO started with supporting cancer patients, running support group meetings. But somewhere along the line, we started to provide screening to indigent women because, as the saying goes, it's better to prevent than to cure. And some cancers are preventable, like cervical cancer. No woman should have cervical cancer, talk less of dying from it. Unfortunately, in Nigeria, every year, at least 14,000 women are diagnosed with cervical cancer. So back then, we started to screen women who walked into our office, into our clinic, and we used to also go out upon invitation to screen women in churches. But a few years into 2017, ACT Foundation came up and, they wanted to support various charities, and they were specific that they wanted to support cancer charities. And so one of the programs we applied for was what we called the Time to Screen. And it was just based on the body of work we had done before then, screening women in various states in Nigeria. And our application was just centered around, we want to screen 3,000 women for breast and cervical cancer. And so our first grant was in 2017. We achieved our goals. We screened the women. We had equipment to not only screen, but to treat any abnormalities that occurred, particularly the cervical cancer abnormalities. And that, year on year, we continued to win grants from the ACT Foundation. And that just took us from 3,000 women screened in 2017 to about 32,000 women screened last year, 2024.
Hold on. Cancer. Now let's talk about cancer.
The big C.
Yeah, the big C, because it's really big. Cancer is something that you hear and you're afraid. A lot of people say it's a death sentence. I remember there was a time I just felt some strange lump in my breast, and I was like, Jesus, like, am I dying? And a lot of people feel that way. From your side of the table, as someone who cares for people who are probably going through cancer, or they're finding out that, I actually have cancer, do you really think it's death sentence? Because some people, I think, the fear kills them faster than the thing itself.
Yeah, so it depends on the perspective. First of all, and I like to be realistic when it comes to this issue of, is cancer a death sentence? Let's start off with 40% of cancers are preventable.
Okay.
So if cancer is a death sentence, then we can't prevent cancer. So 40% of all cancers occurring, globally are preventable. And when we, come down to Nigeria, 40% of the cancers we diagnosed last year, we could have prevented it if girls had been vaccinated, if mothers had, and women had gone for their cervical screening, if people had had their HPV vaccination or their hepatitis B vaccination, or they're just gone for their medical checkup, we would have picked up the cancers at the very earliest of stages. So we are not preventing cancers well enough. Now, to the second batch of cancers, we can't prevent them, but we can detect them early. So like breast cancer, which is the most common cancer affecting women. In Nigeria, we're detecting most of the cancers at stage 3, stage 4, and we don't have cures for such stages. Or we can control the disease. We can slow the cancer from, growing very fast, because that's what cancer cells do. They just divide fast and travel everywhere or spread. So if we diagnose many of our cases at stage 1, when the breast lump is as small as granules, rather than diagnosing the cancers when it's as big as an agbalumo or cherry or apple or watermelon, whatever the size of the lump is. So when we don't prevent cancer, when we don't detect cancer early, then we're leaving it for the worst.
Okay. So do we have systems in place? So I would say I receive letters in my post, I think once every 3 years for cervical screening. I can't remember the timeline now, but then I'll just get a letter that, you're due for your next screen. So even if my head isn't working well, the NHS will send me a letter to say to me, Auntie,
it's time.
You need to do it. When I clocked 40, I got a letter in the post saying 42. I got a letter in the post saying to me that you need to come and check your body, like your entire body. Let's see if you're good. Blood test and things like that. So do we have systems in place? Is this something that is in the works?
So at a government national level, do we have that in place? No. What we have in place is that some government hospitals provide, screening, medical checkup, readily available. But do we have that follow-up system, that referral system, that navigation system? No, it's not as established as in the UK or the United States. On the community level, the charities like Sebeccly Cancer Care have the system in place.
Which is what she runs, by the way.
But we're operating at a community level. So what would it take for us to establish a national follow-up system of every woman within reproductive age who's eligible for screening? It just takes brilliant minds coming together, where we have that in Nigeria, many brilliant minds. We look back at our data, and then because every time a patient registers in the hospital, we collect the data. So the data.
What do we do with the data? Because I went to Lagos State University, for example, and there was a time I went into the office and I saw files.
No, we are better now. So more hospitals are automating, and they are using electronic medical records.
Because I just saw all these people. I'm like, oh no, how would they find me here?
In there? So we've shifted. We're not there yet, and I would love to say, we're 60%, computer-based records rather than paper. I don't know the data on that, but we have more hospitals that are using that, the electronic medical record system. So it just takes a few brilliant minds, dedication, of course, some financial resources to set up the infrastructure, and that deliberate effort to track the women down. And that's it. It's not rocket science, but it's the willingness and the commitment of the stakeholders, and the first stakeholder is the government.
Screening is free because you get help from well-meaning people and organizations, but the treatment, is that free as well?
So for cervical cancer, if we are diagnosing, we support. It's not free. We make it affordable. It's discounted. But for the treatment of cancer, no, it's not free. What we do is we get funding from well-meaning Nigerians and also people from the international community. They donate, and we have a lot of goodwill. Many people have supported us in the past, and they continue to do so. For example, we attempted the Guinness World Record 10 years ago, and we had about 7,000 people stand together wearing pink t-shirts, and we formed the largest pink human ribbon in, in the world at that time. But right now, it's just for Africa.
Will you do that again?
It was tedious. We just went crazy. We wanted to do something exciting, and it was exciting, but it was very tedious. But it was also impactful because we got the community to, understand the needs of breast cancer patients, and they also understood how to support breast cancer patients and the available resources. So people who participated in that Guinness World Record 10 years ago continue to support our work till date with some donations here and there. We have a fundraising campaign called 1K for Cancer. We launched that in 2012. It was founded by Wana Udu Bang, and you can donate us. Yeah, you can.
I know of Wana.
And her work. Yeah. So you can donate as little as 1,000 naira for cancer, and you can donate as much as 2 million, 3 million, whatever you want to donate or however you want to support. So we do have some funds that we are able to treat patients. And now because the NGO is affiliated with the hospital, the NGO has its super discounted price in which it enrolls its patients in the hospital, and then an additional we get additional funding from the crowd fundraising, and in a way patients end up paying between 50% to 60% of the cost of their care because it's been discounted by donations from Sebeccly and discounts from the cancer center, Pearl.
Interesting. So guys, please take care of your health. Women, take care of your breasts. And how do we check? Because sometimes I'm just, doing this
So I can do a demo. I can pick the demo over there, and then I can just explain.
Yeah, it would be nice to know, because it's important. You just don't want to wake up one day and be told that, oh, sorry, you have breast cancer. A lot of people wouldn't handle it well. Make sure you're doing your pap smear.
Yes.
And for those that don't know, some people are not educated, and education for me is not just book knowledge. It's about being aware of things around you. You might be educated and have a master's degree or a PhD, but if you don't know certain things, you don't know. So seek education, seek knowledge, understand things. If you don't know, don't always ask Google, because sometimes when I have any symptoms, sometimes I'm like, Google, by the time you put that thing into Google, it scares you because it might not even be the right thing you're looking at. So please seek help from people you need to seek help from. And I think before we see that demo, another thing I want to say is this: 1,000 naira, a pound, a dollar can go a long way. There are people who are not as privileged as you, who cannot afford the 300,000 naira or the 500,000 naira, for their care. But then imagine if 10 people gave 10 pounds each. That's if you live in the UK. That's 100 pounds. And 100 pounds is 200,000 naira. That would help someone, get treatment. Or even if it's 1,000 people giving 1,000 naira, that would go a long way in helping us see. I wish we could eradicate cancer, because cancer is I don't know how to explain
it's traumatic.
It is traumatic. I have seen very close people, die of cancer, so it's not a good thing. If you had superpowers, Dr. Omolola, and you only have to use it on one thing, and that thing is your profession, what you currently do, what you experience. If you could change anything, what would that be? What would you use it for?
Just one thing.
Just one thing.
It would be to eliminate cancer. Like, no one should ever develop cancer. And so we won't need to prevent it. We won't need to treat it. It just would become a thing of the past.
Okay, but would that not mean that you don't have work to do?
It would be the best thing that will happen if in my lifetime I see that we can cure cancer, because the pain, the trauma, the death that comes with cancer is not acceptable. It's not humanity. And I think it's more painful because we have cancer patients who have good outcomes, who, if we treat, they'll get better. But they can't afford it.
Yeah.
Or there are many states in Nigeria, for example, that don't have clinical oncologists. So thousands of cancer patients, for example, in Kogi State, are being treated by surgeons and every other type of doctor, but there are no clinical oncologists there.
So how do they survive?
They're not getting the best of care. So it will be, I think just eliminating cancer, first of all, will give me peace of mind. There are many other things we can do with that time.
Yeah, absolutely. And that wouldn't even be no work for you, actually, because for you to eventually eliminate it, people need to also get help medically to get to that point where it no longer exists in the bodies. Yes. So,
and just to touch on how we can reduce our risk, because 40% of cancers are preventable. You had mentioned, people should go for their medical checkup. People should get educated about cancer. It's also important that your diet, your nutrition, what you eat, be conscious, have a balanced diet. And balanced diet, in my world, means two things. You eat the right portion of food and you choose the right types of food. So portion means the size, the quantity. Do not eat a large plate of rice. Sort of on your plate, it should be divided into four. A bit of rice, which is carbohydrate, some protein, which can be meat, fish, or any other source of protein, meat, animal or plant. The third portion, vegetables, which, can be your salad or your vegetables. And that's an example of three types or classes of food. And then the quantity, just, be conscious of what you put in. The other thing is around exercise. It's recommended you take 10,000 steps a day. Some people say, oh, it's not scientific. A lot of scientific associations, promote 10,000. The truth is, if you cannot do 10,000, do 8,000. If you cannot do 8,000, just work on getting better, getting your heart to pump better. Because at the end of the day, the best way we can heal our bodies, repair our bodies, is how we nurture it. The truth is, almost everyone produces a cancer cell. A cancer cell is just a mistake of the body. And a lot of times our immune system, our cell cycle is able to identify a cell that is abnormal and it deletes it. So we don't really know the reasons why some people will produce cancer cells and it will go on to become cancer, while others will, their immune system would delete it. Or some person smokes and doesn't develop lung cancer, and another person doesn't smoke and they develop lung cancer. So there are many things we don't understand, but the ones that we understand, your diet, eat well, nourish your body, your exercise. And when it comes to exercise, it's a mix of, just like your diet, it's a mix of everything. You need to do exercise that gets your heart beating. You also need to do exercise that builds your muscles. You need to do exercise that trains your core. And, you just need to talk to someone in that space to find out what works for you. Then sleep. A lot of Nigerians in Nigeria take pride in traffic. They blame it on traffic that you don't sleep. So what happens during sleep? It is the most important time for our bodies to reset and repair. But people,
sometimes it's actually, talking about sleep is not intentional. So I have struggled with sleep I think since I've been having my kids, I've not been able to go back to reset of going to bed early,
So how many hours do you catch?
Sometimes 4. On good days, 5. That's bad.
That's terrible.
So sometimes I go to bed at 2. And because I have to get kids ready for school, I'm up at 6:30.
Okay. And the truth is, everyone has reasons why they don't sleep well or why they don't have good sleep hygiene. But at the end of the day, the best things in life are free. That's a quote by Chanel Coco.
What gives is below sleep. So it's, I honestly need to. Now, I feel very, like a lot of times I feel sometimes I carry my laptop to bed.
No. So, and those are the things you can change. You can snatch back an hour here, an hour there. And the way I like to say it is, it's the quality of your decisions.
Yeah.
If you know so we promote at least 7 hours.
Yeah.
At least 7 hours, not 6 hours, 7 hours. 8 hours of sleep is great, but at least 7 hours. And what that does is it resets your neurological system. It sets your system up for success, especially when you're older. Many people are I don't know how to, they're frigid, they're tense. Yeah. They don't feel too well. They have this ache hair, they have this hair, they have this hair. And they can't pin it to what's wrong. But in there's some issues with sleep. And sometimes some people sleep for 7 hours or 8 hours, but the quality of sleep is poor.
You know the funny thing, I'm sure if my husband listens to this, he's going to really laugh at me saying, things I say to you, you don't listen. Why are you bringing your phone to bed? Why are you bringing your laptop to bed? Just sleep. And on the other hand, he comes to bed and he falls asleep. And I'm like, how do you sleep immediately? It's like, you come to bed when you're tired. Or sometimes I'm like, oh, did you not hear this sound? No, I didn't hear. I was meant to be sleeping. What are you listening to when you're sleeping? So, and this is really speaking to me. Please sleep. I know I don't have the moral justification. I'm not even morally, in line with that path. Maybe I need to work on that. But then now you've heard it from the professional that good sleep helps you.
A whole lot. It boosts your immunity. It repairs your body. Every time we wake up, even when we're asleep, the body is working. And as it's working, it's making its errors. Sometimes there's excess hormone production. Sometimes there's little hormone production. Sometimes a cell makes its own mistake. And a lot of these things are repaired when you sleep. And so setting up, some routines to help you snatch an hour to... I am speaking from experience. I'm not great at sleeping, but I understand the power of sleep. And because I want to grow old, I want to age gracefully, I'm trying to, track back and do things properly. So it's not easy, especially for those of us that are ambitious, upward. We constantly have multiple projects. Well, you just have to make a decision. 10 years from now, do I want to be, here?
Those things even...
Will they matter?
Really.
Yeah. So your exercise, your diet, your sleep, and your water intake. 3 liters of water a day. Not fizzy drinks, not this, not... If you can take your fizzy drinks, but water is key.
Water is important. That I know, that I do. Then this new thing about now we're gisting. This new thing about Monjaro, people exercising. Now, instead of exercising, a lot of people do Ozempic. To lose weight and all. I remember there was a time I said to my husband, am I okay to do Ozempic? And I'm like, why do you want to go that way? It's just discipline. So is it about losing weight now? I think that might help, losing weight, but is it really about losing weight or living a healthy lifestyle to trim up?
It's living a healthy lifestyle and avoiding the shortcuts to success. So things like Monjaro, Ozempic, we have the medical indication for prescribing those drugs.
Yes.
But you and I, it is better we go the natural, laborious route of exercise, sweat it out. I'm the type of person a long time ago, I just like to chill. Don't make me sweat. Don't let my heart beat. But recently I got on the scale and I was like, what was this?
I can't even say what I weigh in public. I can't even stand in front of someone
and weigh it.
Nah.
In fact, I weighed myself recently in the clinic and the nurses escorted me because they knew I didn't want to weigh myself. But anyway, when I got there, I looked at it and I was like, okay, now you have to go back. Like, you're either going to set yourself up for obesity or knee issues, and right now you still have many years to correct this. And I've started. And so every week I play tennis twice. And every time I look at my tracker, I'm not hitting 10,000 steps, but at least I'm 1,000 steps better than the last month. And I think the last thing would just be what you don't measure, you can't track, you can't make progress. I know there are many fit buffs, around, and the reason why they are fit is not because they just want to be fit and static. Even when they are fit and they've built all the muscle and they have great cardio pump,
they keep going.
They still keep going on, because the truth is the body is a machine, like it's a natural machine that can sustain the person to, into old age, and it's just beautiful. So how you use your body, prepare your body for old age, is something you can make a very great decision on. So, but sometimes we misprioritize, we put everything work in front of us and then take our health backwards. Then we say, oh, we're having fatigue, we're this, we're tired, there's depression. Exercise helps, lifts the mood, there are just so many things that we take for granted because we are adults.
Yeah. So guys, I honestly can go on and on. It's been very amazing speaking to you. I've enjoyed this thoroughly. It feels like we've had these conversations before. Thank you. Before you then show us
the
demo, what would your advice be to women?
We women. My advice to you would be, and this is from my clinical experience, because I treat a lot of women with breast and cervical cancer. And what I see that is most important to the women I treat is they just want to get back to life before their diagnosis. And for many of us that have not been diagnosed with cancer, we thank God, it's grace, it's God's grace. Therefore, prioritize your health. And when I say your health, your physical health, your mental health. Many women are angry for no reason. Many women pick up a fight, very easily. Many women are not able to walk away from unnecessary battles. Many women sacrifice for their family, and that is important. We're built to sacrifice, but do not neglect yourself. Find time for your exercise, for your self-care, and your self-care may be going to the salon or getting your spa done or your nails or whatever is unique to you. Just create a few hours a week that is for you, and everyone in your family respects it, that this is my time. Whether you're single, your time. If you're a mom, mommy's time. The children know that this time is for you. And, have a self-care plan. Plug it into your diary. Just take care of yourself, because at the end of the day, we want to go through life having enjoyed life, winning the most important battles, walking away from the unnecessary battles, and being there for our loved ones. So prioritize you. These are silicone explants. These are prostheses, breast prostheses, and this is what we use to explain to women how to do their breast self-examination. But it's also the same explants that women who have done breast cancer surgery use. They put in their bras, just so that, it feels the same weight, and, it's silicone. It feels almost natural. Yeah. And as you can see, this is dark brown and this is lighter skin. So as Africans, we have darker skin. Anyway, so for the breast self-examination, the most important thing is choose a time you're comfortable to do your breast self-examination, which is once a month. So for example, if you're born 5th of August, you can choose to do your breast self-examination every 5th of August.
Okay. Of the month.
Of the month, yeah. So starting off with, we know this is the nipple, this round area is the areola, and then all of this is the breast tissue. And so when you're doing the breast self-examination, you want to look at your breasts in the mirror. You've removed your bra, your t-shirt, and you're standing in front of the mirror. And of course, the breast will be in this position. And you're looking at the skin of your breasts. Any skin changes, any rashes. Some people have pimples when they're about to menstruate. That's normal for many women. Okay. So the most important thing is you take a look at your breast skin, you look at the areola. Does it look the way it normally looks? Are there any recent changes in size of the breast? So a lot of times as a doctor, when I'm examining a woman with a breast abnormality, one of the things I want to confirm is any breast particularly bigger than the other? But knowing that naturally
One is usually bigger.
one is normally bigger than the other. Just in women, same thing for men. One testis is bigger than the other and lower than the other. So, but when we're talking of breast cancer, some women say that all of a sudden, 2 weeks ago, 2 months ago, recently, one breast got bigger than the other, or one breast looks harder than the other, or the skin is shiny. So those are some of the things you're looking for. Any rashes, any holes, where the breast skin looks like looks like the orange fruit, those dimplings.
Like dimples.
Yeah. Any change in position of the nipple. For some women, like this prosthesis, the nipple is pointed outward, and that's normal for some women. For some women, their nipples are tucked in, and that's normal.
Yeah.
But all of a sudden, if the nipple is pulled inward, then that's something to report.
Yeah.
So that's what we do when we are looking at the breast. Then we go to the touch phase. You can touch the breast, in the standing position, or the lady lies down and then the breast is in this position. Okay. And to touch the breast, if this is the left breast you're examining, you use 3 fingers. The index, the middle, and the ring finger. Yeah. So just feel comfortable with it. The most important thing here is take a deep breath.
Okay.
Trust yourself. You're going to use the pads of your finger to go around the breast. A lot of women will do this. They're like, what am I feeling for? What am I?
Circular.
Yeah, you go circular. You may choose to start inner as you have started, and then you go out this way. Or you may choose to start from outward.
Okay.
And as you go in, you come towards the center.
Okay.
You apply firm pressure, not hard, just firm. And as you press into your breast tissue, you're just feeling, what do you feel? Do you feel something soft? Do you feel something hard? And you just go around, you go around, you go around. If you feel something hard, which most times is the rib, that's the bone underneath the breast, you check the other breast.
Yeah.
So a lot of women have tiny dots around here, which is normal for every woman has that. A lot of women have it, but when they press, they think it's a lump. So the first thing you do is you check the other breast. Is it there? If you don't find it there, then yes, you should report that to your doctor. But most times the little glands around here, we call it Montgomery glands, long name. It's normal to have those tiny things. They're so tiny. So 3 fingers, you go around, and then you just appreciate how your breast feels. And for some women, the breast feels tender, slightly painful during period, a few days during or after period. And other women, they don't have any form of pain. So once you've gone round and, you felt the hard part of your breast, the soft part, the firm part, if you feel fine, then that's it, you've completed. The goal of the breast self-examination is to ensure that everything feels fine. You're not finding anything new. What are the new things a woman can find in her breast? A lump. And a lump feels different from the breast, especially if you're familiar with your breast. A lump feels harder than anything in the breast. Sometimes when you touch it, the lump can move around, or sometimes it's just in one position, and you keep going there, you will find it there. For some women, when they have lumps, the lump hides around and they have to sort of look for it. What else? I'd mentioned earlier that a woman may notice that the breast all of a sudden changes in color, the skin changes, or there may be a new rash, or the nipple may be pulled inwards, or all of a sudden the breast looks bigger or feels heavier than the other. And then, of course, the breast starts from the armpit. So it's important to take your 3 fingers. You can make it 4, and then you just go in there and you check. And that's it.
Thank you. If you haven't been doing that, it's a good time to start it. If you've been doing it the wrong way, maybe you need to rewatch this video, rewind, pause, rewind, try it again. and then make sure you're safe. Thank you very much for watching us today and for listening.